Idaho ranks 50th in the nation in physicians per capita. A working group with the focus of addressing medical education presented for the Joint Finance-Appropriation Committee, finding Idaho needs 1,400 new physicians to even reach the national average.
And I would say actually in a crisis mode. I've used that word several times over this year, but I truly believe that's where we're at as a state when it comes to medical education and physicians per capita.
Representative Dustin Manwaring of Pocatello presented some of the working group's findings and recommendations for the committee, saying, quote, "We can't go backwards."
We aren't talking enough about the problem, and we just need more healthcare professionals. We're talking about physicians, but healthcare professionals in general. It's been on my radar for a couple of years, but I would say we've probably been growing into crisis mode for a decade.
An area of focus is in rural Idaho, needing to incentivize new medical professionals into going to smaller, more rural areas of the state.
Getting those training opportunities out into rural Idaho, on the one hand, and on the second hand, we do have to build up the facilities. You're going to have more providers and more facilities before you can get the training opportunities. And
the working group called on the committee to approve funding for additional undergraduate medical education seats, establish a health education director to coordinate the planning of the programs, and support a, quote, "accountable rollout of a medical education plan."